Hello, viewers. Welcome you to today's episode of Limi Hospital's Instagram Live. We'll be discussing urinary tract infection in pregnancy, the importance, and why it is necessary for us to talk about this. I am Dr. Amanda Chinyere Dikeukwu, personal physician with Limi Hospital, Abuja. And with me is
Dr. Taiwo William, a consultant obstetrician and gynecologist, Limi Hospital, Central Business District, Abuja.
welcome you once more. Like I earlier said, we'll be talking about urinary tract infection in pregnancy, UTI. What is urinary tract infection? Simply bacterial infection in any part of the urinary system, ranging from the kidney and the bladder. Why is it important to discuss this topic? It is because there are certain risk factors and negative outcomes of urinary tract infection if untreated in a pregnant woman. That is the importance of this discussion today. And we hope that at the end of this discussion, you will pick one or two things why you find it necessary, especially our pregnant mothers, to adhere to instructions and antenatal care, especially the routine urinalysis done in every antenatal visit.
In fact, simply to add to what Dr. Amanda has just said, when you have an actively dividing bacteria in the urinary system in pregnancy, that's why we just say that there is urinary tract infection. And for some group of women, there might not be symptoms at all. And for some women, they might have symptoms. That underscores why we routinely screen women, pregnant women, when they come for antenatal, for urinary tract infection. And because of that negative impact on the life of the mother and the baby in her womb, that's why it becomes important for us to actually screen. And since we have seen that a number of women, their attitude towards this, when they come for antenatal, somehow nonchalant attitude, despite information, sometimes they look at it, why do I have to? I did it last week when I came now. There was nothing, I don't have any symptoms, so let me go ahead. So that's the reason why today we are discussing this, so that we can be better informed and we'll be able to develop a good approach, a better approach to the management of our baby before they are born, so that we can carry pregnancy and deliver safely. That's the essence of it, why we are discussing this topic today.
Okay. Urinary tract infection can actually happen in both sexes, male and females, but commoner in females. Then among the females is also the pregnant ones are more prone to having urinary tract infection, UTI. Reasons being that pregnancy is a state of immunocompromised, which further reduces their immunity to certain organisms implicated in urinary tract infection. Secondly, the protruding tummy may make it difficult for the women to appropriately clean up, which predisposes them to urinary tract infection in pregnancy. There are other physiological changes that occur in pregnancy, which also predispose them to urinary tract infection.
The hormone of pregnancy, especially the progesterone, helps. It relaxes the muscles of the urinary system, especially the ureter too. And because of that, there is slow flowing of urine, what we call urinary stasis, which can encourage multiplication of bacteria. And I used to compare it to all of us. We have gutters in the house. When you have gutter that water is not flowing well, gradually you will start seeing that different things are occupying the gutter and it becomes more unclean. It looks like that. But if you have a gutter that your water is flowing frequently, nothing will stay there. And that's what happened, why that hormone too also predisposed, because of that slow flow of urine. So it's a risk factor. And there are even some other reasons why it is like that too in pregnancy. The urethra is short. the urethra is closer to the vaginal anus that are not completely devoid of microorganisms. So easily they can track towards that environment, and they can ascend through the urethra into the bladder, and from there too they can even get to the kidney and cause infection of the kidney, infection of the bladder, which can be symptomatic in most cases and sometimes asymptomatic.
There are various organisms have are implicated in urinary tract infection. The commonest being Escherichia coli, commonly known as E. coli, and there are others, but that's the most commonest. That's the most common pathogen in about 80 to 90% of cases. Also, the prevalence of UTI in pregnancy is high. In about 10 pregnant women, 5 to 6 may have bacteria in their urine if cultured, which is significant, and the reason why every pregnant woman should pay attention to her routine urinalysis
In
and the
fact,
outcome.
when pregnant women come for antenatal booking, it is important, it is recommended that at least maybe between that 12 weeks to about 16 weeks, which is around the time that most women will come for, are expected to have registered for antenatal. They should have at least a single urine culture so that we know whether they have this uh, bacterial infection of the urinary tract system, and it can be well taken care of. They can also be categorized into low risk for urinary tract infection and high risk for urinary tract infection based on the risk factors they have, which include
Um, Certain risk factors like women who have other coexisting medical conditions that further reduces their immune system, like diabetes mellitus, women who are on certain drugs like cancer drugs, on prolonged use of steroids. Such drugs reduces their immunity generally. Then some other conditions like sickle cell trait. Pregnant women, a woman with a sickle cell disease is more prone to having urinary tract infection compared to an otherwise normal woman with a pregnancy.
in fact their risk is double those that do not have sickle cell disease trait. And for those who have diabetes mellitus, it's been said that they are 3 times more at risk of having urinary tract infection
Infection.
than those who do not have it. And also people who have acquired immunodeficiency disease, HIV infection, if they are not on highly active antiretroviral drug to suppress the viral load, they are also more at increased risk because of immunosuppressive states that they usually have. So they can come down with uh, urinary
Frequent
tract
UTI.
infection more frequently than those who do not have such a condition.
Other risk factors include low socioeconomic status. Um, Women with a low socioeconomic status are more prone to having this disease because of a poor hygiene. And other factors like um,
Even they might not be eating well, you understand,
yes,
because they
nutrition,
can
poor
the kind
nutrition.
of food they have, they may be lacking some essential nutrients in the body that are responsible for the build-up of the immune system. So it's also very, very important. There are some other people too that have all these congenital abnormality of the urinary tract system. They are at increased risk of having urinary tract infection in pregnancy. Those that have what we call kidney stones, urolithiasis, that's in medical term, kidney stones, they are at increased risk of having urinary tract infection. In fact, recurrent urinary tract infection. When we see women that are being treated recurrent, more often, we also want to rule out all these conditions so that we can identify and manage them as appropriate. Very important.
Also, first timers, what we call primates, the primate gravidas, they're also at more risk because of inexperience. That is why it is very important for such persons to seek antenatal care in a health facility and adhere to the instructions given during their antenatal visits. Then there are types of urinary tract infection. We'll be talking about the common types seen in pregnancy, which ranges from asymptomatic bacteriuria to acute cystitis and acute pyelonephritis. Asymptomatic bacteriuria is simply the presence of bacteria in urine culture of a woman without any symptoms of urinary tract infection.
which you can find in about 2 to 10% of women that are attending that are pregnant. You know, they won't have symptoms, but if you don't screen for it, you won't be able to detect it. And that means for those group of women, a number of them can even come down with symptomatic uh, urinary tract infection, such as the acute cystitis or pyelonephritis, if not treated. And that underscores the reason why when they come for antenatal, we want to screen. We take history, we want to know those groups that have some other special risk factor that can make them to be more prone to urinary tract infection. Apart from that, even without having any other risk factor, you understand, we want to screen everybody generally for this asymptomatic bacteriuria, which is presence of actively dividing bacteria in the urinary system without any symptom.
Asymptomatic bacteriuria, if untreated, progresses to acute cystitis, maybe an ascending infection from down the urethra up to the bladder, if untreated. Acute cystitis may present with symptoms. But simply put, it's the presence of bacteria in urine culture with maternal symptoms. Symptoms like burning sensation while urinating, dysuria, frequent urination,
Like every 2 hours, you want to go and wee.
we
You sleep in the night sef,
wake
you are
up
waking
at
up,
intervals to.
and then that increased frequency of urination at night disturbing the sleep. The woman will not be comfortable. you know
Some other, in severe cases, they may come down with hematuria, that is seeing blood in urine. Chief acute pyelonephritis.
okay, the most severe form of urinary tract infection in pregnancy is actually what we call the infection of the kidney. And infection of the kidney is what we call pyelonephritis. That's what we call when the kidney, which is located on the side, on our side, where when we are standing and want to show people where we hold, that's where the kidney is. And that's why people who have it, they come with complaint of flank pain or loin pain, that there is pain here. It could be just one side, which we call unilateral. It could be the two sides, which we call bilateral. And for those people who have pyelonephritis, which many a times is as a result of undiagnosed or untreated asymptomatic bacteriuria or poorly treated acute cystitis or asymptomatic bacteriuria, it can result from this. They can equally present with fever, which can be high grade fever. It can look like the fever is going up and down. Like some people will say, if the fever is up and down, it's malaria. Sometimes it's not malaria. It may be pyelonephritis. So that's one of the things we see there. They can even be shivering. They will be feeling cold and shivering and shake. So these are some of the symptoms that we can see. And the other symptoms, as earlier mentioned, increased urinary frequency, excessive urination even at night too, painful urination, which is dysuria. We can also have even hematuria,
Blood in urine.
blood in urine.
Okay, acute in pyelonephritis is a more serious form of UTI in pregnancy because it has both risks. There are risks both to the fetus and to the mother if not properly managed. It can lead to, in the mother, it can lead to certain conditions like preeclampsia, where the woman will come down with
High blood
pressure, protein in
developed in
urine.
pregnancy. Yes, it can even cause some respiratory distress syndrome, meaning that the person is not able to breathe well because of the infiltration of the lungs with toxins. You understand, including white blood cells, and then now causing fluids to gather in the lungs rather than here occupying the lungs so that we can breathe well. it is possible. It can also be a reason why some people, their kidney might fail. It can be a reason why some people around their kidneys, they can have pus collection, what we call abscess. They will keep on having fever every now and then. If not properly investigated and discovered and appropriate treatment is instituted, these people will live in this kind of condition. And it can be a reason why some people, some women, will eventually lose their baby. Some will have miscarriage, some will have preterm labor, some will preterm contraction, meaning that there is just uterine contraction and there is no cervical dilatation or cervical changes. And it can progress to preterm labor where there is contraction, the cervix is opening, shortening, and the process of labor has started. And eventually it can lead to delivery of the baby. And if babies are delivered preterm, there are plenty complications that can happen to such a child, that can even threaten the life of the baby, or that can affect the functionality of the baby even if the child survives. You understand? So that's why it becomes very, very important for us to take this serious. If you go to the antenatal clinic today and the doctor has not reviewed your urinary urinalysis,
Analysis.
remind the doctor, remind the nurses, wherever we find ourselves, that I did urine check. Please, what is the
What
result?
is
I want to know it. And if you have not done, if you are in the habit of not doing it routinely, because we just want to do everything sharp, sharp and go back
Or
to our
probably we
basic.
don't know
Please,
the
let's stop
reason
it.
why it's
Yes,
requested.
it's very important, especially for the sake of our unborn
Unborn
children. Nobody should carry baby these days and be miscarrying baby because of condition that we can manage.
Or have a preterm delivery with
No.
the barrage of consequences that come with preterm, with prematurity. Yes. Then this UTI can actually be prevented. Yes, can actually be prevented. So what
we
are the
we've been talking about measures by which you can prevent
prevent?
it.
Yes, like
The measures include screening in antenatal. When a woman comes, we screen them for urinary tract infection by doing urinalysis. That's urine test. We submit urine. We have strips that we can put inside the urine. It has different parameters that it measures. When there is protein, there is leukocyte. We are seeing a nitrite.
nitrites.
Is suggestive, highly suggestive of urinary tract infection. Even there can be blood
Yeah.
there too that can
In such
suggest.
situation,
Don't
we go
forget.
ahead to culture the
Yes, we
urine.
want to do urine culture. When we identify those ones, those parameters, we do a urine culture to isolate, to identify the microorganism that is causing the urinary tract infection so that we can treat it appropriately. Of course, we talked about our personal hygiene. It is very important. Everybody can improve on our personal hygiene. It's very, very important that we look into this. And also, people with pre-existing medical condition that can actually affect, that can make urinary tract infection to be more common in pregnancy, we should take care of it. And that's why I could remember just a couple of months back, on this platform we discussed what we call preconception care, meaning that people with this medical condition, we have managed them, we have controlled the disease, they are living a healthy life. The risk of having urinary tract infection will be minimal.
Reduced.
Take for example, someone that has HIV infection, we have already placed her on a drug
Proviral drugs.
that can suppress the viral load. That person will live a normal life. It's just that she's on drugs. People with diabetes mellitus, they have controlled their blood sugar. It's when there is excess blood sugar in the body, that's where in the blood, that's where it can seep into the urine. You understand? And then it becomes an issue, a culture media for the microorganism to try to grow. You understand? So that's one thing about it. The same thing goes for people with sickle cell disease. They have anemia. We want to improve on their PCV, their blood level. We want to improve on their general health status. This is very, very important. May God help us. Well, once again, this is if you are just joining us, I'm Dr. Taiwo, consultant obstetrician and gynecologist from Limi Hospital, Central Business District, Abuja, and with me is
Dr. Amanda Chinyere Dikeukwu, personal physician with Limi Hospital, Abuja.
What we have been discussing so far is urinary tract infection in pregnancy, which is a common thing that globally, worldwide, there is no place in the world that this condition we are describing is not in existence. And there are guidelines, and that's why we are talking about what we can do to reduce the incidence or the prevalence of UTI in pregnancy, urinary tract infection in pregnancy, and its attendant complication on our pregnant mothers and wives, and then the unborn
fetus.
children, so that we don't have bad outcome. Maybe should not be dying. There should not be miscarriage. We should not be adding more costs. If a child is born preterm, that child has more tendency to stay in hospital, in neonatal intensive care unit, more at more cost. Some women, some parents are looking at how we are pricking, collecting blood sample to check for, to do some tests, trying to set lines so that we can give necessary antibiotics, medications, and the like. We can avoid all these things if we, employ the correct attitude into, that can help in preventing urinary tract infection. We have also talked about ensuring that we are well hydrated. That was why I mentioned, the kidneys, the gutter bit that is being flushed regularly. Nothing will stay there. It will be looking clean. But if it's just flowing slowly, many different things, ugly things will flow there.
Start breathing.
Yes. So if all pregnant women are expected to drink plenty water, and unfortunately for us, we have entered the dry season where everywhere is hot. Yes. And we require more water. So if you are just joining us and we are pregnant, at this period of time now, please, we need to drink plenty of water.
At least 3 to 4 liters of water in a day. Yes. Then empty the bladder intermittently. Form the habit of emptying the bladder from time to time. Avoid to reduce the stasis of urine and multiplication of bacteria in the urinary tract.
In fact, let me add something to it. Sexual activity has also been found to increase the risk of urinary tract infection. In order to now avoid this risk, it is encouraged after seeing our husbands, we should try as much as possible to empty our bladder. It can help to reduce the ascension, the migration of microorganisms from around our vulva through the urethra into the bladder and then up into the upper part of the urinary system. So it's going to be, this is helpful.
Okay. Then, treatments generally, I would like my senior colleague to also give a summary of the treatments of urinary tract infection in pregnancy.
Yes, how do we treat? Simply put, before you institute antibiotic treatment simply put, you give antibiotics, but we need to investigate. And the investigation starts from history taking to know the kind of symptoms we have. We want to examine the woman. We check, are there things that can suggest that a woman is having symptomatic urinary tract infection, such as acute cystitis. By the time we check the tummy, if you have we assess that the woman has pain, especially over the just above the pubic hair. We might be suspecting, or around the loin, the lumbar region. Okay, we might be suspecting that maybe there is kidney infection, pyelonephritis. But that will not be enough for us to make that diagnosis. We want to do tests, urine tests. We'll quickly do a dipstick. And if it shows that we are having leukocyte, we are having nitrite, we are having protein or blood in the urine, maybe 2 or more, or sometimes even one of these can give us an idea, and then we start looking at it that, okay, we need to investigate further. And how do we investigate further? We do a urine culture test. And this culture test is very, very important. I think I need to enlighten us more about how do we even give sample. for urine
Yeah.
culture test, because these are issues, critical issues, even in the hospital. Sometimes people give sample, but they give samples,
No,
that have
contaminated.
been contaminated. I'll be seeing something else and be wondering, is it truly, you know, does it truly mean that this person has
This.
urinary tract infection or not? Of course, the sample that we collect for urinary tract infection is clean catch urine. And how do we collect it? If you have collected rainwater when it's raining, we will never tell rain to stop. I want to
Yes.
put bowl
No.
inside it. It has started raining
Raining. Yes.
before you go and put your bowl. Then you put your bowl, you collected
Collect
your water, you
before the
carry it
rain.
back into the house. That's it. Now for clean catch urine, we want the woman that
Initiate.
is to be given that is to give the sample to wash
The
her
vulva.
private part with just water, normal clean water, and pat her labia, so that as she's holding the sample bottle,
Example.
she will start urinating without stopping. When you start, the first few seconds are gone, you just put
The
your sample
sample
bottle
bottle.
to collect small, half bottle of it is okay. We don't need it to be full and be
Overflowing.
overflowing. Is there are some other things that can be overflowing. This one, just half of it, or 2/3 of it is
Yes.
more than enough for us. And you empty your bladder completely, you give us the sample, we check it. And if it's now showing that there is a bacterial infection growing, then we will isolate it. We will test the drug that can be used in treating the kind of bacteria that is responsible for urinary tract infection. But before the result will be out, we can take up to 48 hours. In most places, 48 hours before the result will be out. We usually place them on antibiotics. Generally, we say broad spectrum antibiotics, meaning that antibiotics that can cover for a variety of organisms that are most common in that environment,
Mhm.
so that we can start taking care of it within that 48 hours. For those people that will respond well to the antibiotics we have instituted, you will see resolution of symptoms. Somebody that is having painful urination, dysuria, there is no more
No more
pain.
diarrhea.
Somebody
Fever,
that is having
menstrual
fever
bleeding.
is already going down. You understand? Then we will know that this our antibiotics is working, and that helps us. Then we are now talking in terms of how long do we treat. Of course, it's based on whether it's just the infection of the bladder, which
Or
most of the time within 5 to 7 days, at most 10 days, we are treating for that. 5 to 7 days we have completed. And we encourage our women, when they are on antibiotic for urinary tract infection, you don't stop at the time when the symptoms have resolved. You stop it when you have finished the drug that you have been given.
given.
Very important. Then when you are treating for pyelonephritis, which is the most serious type of urinary tract infection, you need to treat. That woman should not take antibiotic for less than 14 days.
Yeah.
But in our environment, what we see today is that once we are relieved, we forget about it. Our pain has been taken away. Then we don't care about it again. And that's one of the reasons why for some people they have relapse or recurrence of urinary tract infection. For some people, they have developed resistance to antibiotic treatments. But we want to encourage our viewers out there, please, if you have this condition and your doctors or the health practitioner that is attending to you at the antenatal have placed you on medication on antibiotics for urinary tract infection, we want to encourage us to please ensure that we complete our medication. It's also very important too that we take plenty fluid. We talked about this when we're talking about prevention. It is very, very important. That's why you will take note that at least most times when they come into the hospital, we also place them on fluid while we are asking them to also take plenty fluid, because we need them to continue to produce urine. We are not afraid of you are urinating too frequently. We want it so that it can continue to flush the system and reducing the bacterial load in the system while the drug is killing them too. So very, very important. Well, we won't be talking about the various form of drugs, because it is important for us to note that some drugs are not safe for our baby. Some women are delivering babies that have congenital anomaly because they have been treated by people who are not qualified, who don't take into consideration their baby status.
Yeah.
They just give them drugs, and those drugs can affect the development of their unborn children. So it's very important we take medication as prescribed by qualified professionals. It's very, very important. May God continue to help us.
Um, in summary, we've practically talked about UTI, the effects and the effects in pregnancy and pregnancy outcome. So, in summary, we've said what UTI means: bacterial infection in the urinary system, which could be in the bladder, in the kidney itself. The common risk factors that could predispose pregnant women to that further predisposes pregnant women to UTI, because pregnancy itself is a risk factor because of the physiological changes. Then we've talked about other comorbidities that will make a pregnant woman to be more prone than an otherwise normal pregnant woman to have UTIs. We've talked about the prevention and also encouraged our viewers, especially our pregnant mothers, to seek care in health facilities, follow strictly antenatal instructions and routines, follow up their results, and when cancelled, especially some women will come with symptomatic urinary tract infections, you cancel them on the need for treatment. Maybe they will require hospital admissions for severe ones like acute pyelonephritis. They will turn it down because they really don't understand what the doctor is trying to prevent, both in them as the mothers and their unborn child.
On that point that you have just mentioned, sometimes we see some of our women like that will turn down admission. And unfortunately, some have ended up, you know,
Having more
miscarrying
complications.
their babies. Some have ended up having to deliver preterm and eventually losing the baby. Some, they have to spend more time just because we felt, my work and other children. We understand. We don't want to inconvenience our patients. We who we call guests in Limi Hospital to at least encourage our patients to understand the fact that we identify with them. We want to let you know that the whole essence of treating, especially admitting, is to ensure that we take care of the acute illness, the emergency things that can worsen and cause more serious complication. That's what we want to do. As soon as you are better, we want to discharge you home to continue your oral medications, and then we give you appointment to come for follow-up so that we can monitor. Of course, what is expected is that after treatment of symptomatic
UTI.
UTI in pregnancy, about 1 to 2 weeks after, ideally what is expected is that you should have another urine culture test to confirm that what we cultured before has cleared off. It's as simple as that. Even though when you give appointment, many a times people still don't bother to, I'm fine now, so I don't need to go and sit down for 15 minutes, 20 minutes in that clinic.
Some think it's an
it's not
avenue for the hospital to make more money. That's why they give frequent appointments.
No, it's not that. We just want to be part of your joy to have your baby. We want to identify with you and your family, and want to contribute to what God is doing in our homes, that you can have your baby and have a healthy baby. And we can have what we call safe motherhood experience, where the mother is sound after delivery, the baby is healthy, bouncing, and the father too, because the father too is also important too, is also happy and healthy. That's it. That's what we want.
Yes. About suppressive therapy in those with recurrence, when you treat and they keep coming down with.
Okay. My colleagues was trying to ask me about what we call suppressive therapy. Why do we do that? For some of our patients that keep coming down with urinary tract infection, which we earlier mentioned, such as in people with congenital anomaly of the bladder, of the urinary tract system. You understand? Some, there is what we call offshoot kidney. Some we have their kidney in the pelvis. You understand? It can predispose them to recurrent urinary tract infection. Some, of course, when we have situations like this, we want to put them, or some that have kidney stones, we want to put them after 2 or 3 courses of antibiotic therapy. We might give them another antibiotics, what we call uroseptic septic drugs that can help to keep the urine in such a way that it will make it difficult for bacterial organism to grow within the urine. So we place them on medication, but before we place, we individualize patients. That is why it's not something that we can go out to pharmacy and just get drugs anyhow. Some are injurious to the baby, some are injurious to the mother, and that's what we don't want to cause harm while treating another ailment. So we want safety for the mother and safety for the baby is very, very important.
In conclusion, early diagnosis and treatment of UTI in pregnancy is the hallmark of safety, both to the mother and to the unborn fetus.
Well, if you are just joining us once again, uh, I am Dr. Taiwo William, consultant obstetrician and gynecologist, Limi Hospital, Central Business District, Abuja, and with me.
Is Dr. Amanda Dikeukwu, personal physician with Limi Hospital, Central Business District area, Abuja.
And before now, we've been discussing urinary tract infection in pregnancy. Please, all our viewers out there, whether you started with us or you are just joining us, we want you to keep your questions coming because we actually want to address those concerns that we have. If we don't have enough avenue to discuss with our healthcare providers during antenatal clinic, this is an avenue to ask your questions and to have answer directly for people that are trained to answer such questions. We want you to keep it coming. It can never be enough or overwhelming. Please, let's clarify issue.
Okay, thank you. Okay, Chief, here we have a question from one of the viewers. Question says, which factors increase the risk of a urinary tract infection during pregnancy?
Okay, this we've mentioned it during the earlier part, and the factors that increases the risk of urinary tract infection in pregnancy include the fact that pregnancy itself is a relative state of immunosuppression. Because if that is not done, the body will recognize baby that is growing in the womb as a parasite and want to fight it.
Yeah.
So very important. And the fact that the physiological changes in pregnancy, such as the progesterone effects on the renal system, which relaxes the smooth muscles of the renal system, especially the ureter, thereby making urine to stay for a longer time, can encourage multiplication, of bacteria in the urinary tract system. So it's very important. And because some people have these physiological changes in pregnancy or some pre-existing medical condition, may make it difficult for some of our pregnant mothers to take good care of their private parts well. And by not taking care of it well, they can eventually end up having contamination of their urethra with feces or vaginal discharge that are containing microorganisms, and this can lead to infection of the urinary tract system and can give them this infection that we are talking about. So it's very, very important. And some other pre-existing medical conditions that we have mentioned before: sickle cell disease, HIV in pregnancy, diabetes mellitus, people that are on steroids,
low socioeconomic status,
low socioeconomic status.
parity.
So very, very important.
So the next question says, why is the risk of serious complications of UTI increased during pregnancy?
Well, we cannot overemphasize the physiological changes in pregnancy.
Yeah.
Pregnancy affects every system in a woman, including the skin, our brain, including even the kidneys itself. Okay, the blood. In terms of increase in plasma flow, the water component, the cell component of the blood. These are important things that makes it, more complicated, especially in pregnant mothers. There are all these changes. And more importantly, because many a times we have what we call this asymptomatic bacteriuria. People don't subject themselves for treatment, for screening and treatment. People don't complete their
their
treatment.
treatment.
Once they get relief small,
They
they abandon it and the thing rebounds.
and most don't come for follow-up.
So these are reasons. So there is another question that says, what are the treatment options for urinary tract infection during pregnancy? The treatment option, simply put, is antibiotic treatment. There is nothing else that we want to give. But antibiotic treatment plus some other, of course, liberal fluid intake so that we can continue to flush the urinary system is very, very important.
Improved hygiene.
Yes, of course, people who are already developing complications, following urinary tract infections in pregnancy, such as they are having preterm contraction or preterm labor. We may want to manage that one. There are ways we manage to want to delay onset of labor so that baby can grow to that 9 months that we all expect that baby should be born. So there are things that we do, and that is why it is not what we can treat online, or it is not what we'll be calling one doctor, one nurse, it seems I'm having this, we need to get to the hospital so that we can be examined and be given the appropriate treatment is very, very important.
Okay. The next question says, what are the signs and symptoms of acute cystitis in pregnancy?
Well,
We've talked about this repeatedly. The common symptoms of acute cystitis ranges from pain, suprapubic pain, pain in the lower abdomen, frequent
that's
urination
below
the
the
umbilical
belly button.
yes, frequent urination both in the day and night. Some will have urgency. Urgency is when they can't hold on to.
They have to rush down, or else they will wee on their body. How will an elderly person be wee on the body? God forbid.
And in more severe cases, they may come down with hematuria, that is blood mixed urine. Other symptoms like fever, in a more serious, like in acute pyelonephritis.
Yes,
They may
fever,
come down with fever,
chills,
flank pain.
yes,
That can even be mistaken for acute appendicitis.
yes,
In some cases. Then worst symptoms are when complications are setting in, like sepsis, that will
yes.
maybe relate to respiratory distress
Some
syndrome.
people can have shock
Yes,
because of the toxins that some of
toxins.
these bacterial organisms are releasing into the bloodstream. So very important. Yeah, someone has a question that the urinalysis says I have a urine infection. Do I have to treat it? Yes, so
Yes, you have.
it has to be treated.
Has to be treated.
World Health Organization.
Asymptomatic bacteriuria.
Yes, in the World Health Organization guideline that was released sometimes in 2016 says that under what we call a positive pregnancy experience, some of the tests that pregnant women should do in antenatal is urinalysis and then urine culture, depending on circumstances. You understand? How it has been stated that all asymptomatic bacteriuria, meaning that a woman having bacterial organism multiplying in the urinary system but without symptoms must be treated to prevent the risk of having symptomatic bacterial UTI that can eventually now lead to more complication in both the mother and the baby. Yes, this is one of the ways of reducing both morbidity and mortality in the mother and the unborn child. Yeah.
Okay, someone asked, can I be prescribed an antibiotic in case I have a future infection? The answer is still yes.
Yes, of course, we don't anticipate that we will have infection, but all the same, if you have infection, we want to identify the type of infection you have and give you appropriate antibiotics so that we can take care of the situation before it worsens. That's it. Early presentation might affect the need, for
prolonged
inpatient care, for you to be admitted in the hospital and be treated. So if you present on time, it's very, very important.
Okay, Chief, there's another question here. My partner has a catheter. Why don't they prescribe an antibiotic to prevent urine infection?
Well, it's not all patients that have a urinary catheter that has to be on
Antibiotics.
antibiotics. Patients are individualized. Very, very important. Patients that are having prolonged urethral catheterization, it might be necessary to screen them intermittently for urinary tract infection and put them on antibiotics. But in most cases, especially that has to do with uh, pregnant women, especially people that have maybe postpartum hemorrhage, people that have cesarean section done, within 24 hours, we have already removed the
Remove the
catheter.
catheter.
You understand? So it's not a reason why we want to put on antibiotics, but there are some that needs to be put on antibiotics. When the woman is now on catheter and you notice that the color of the urine is becoming cloudy,
Cloudy.
or the woman is having
Symptoms.
pain over the suprabluary region, it becomes important
To call.
for us to investigate and
And
treat.
treat. Yes.
But please, antibiotics has to be
Be
prescribed
prescribed. Yes.
by the people that are trained
To do
to
so.
to do so. Very important.
Okay. We have what circumstances can lead to urinary tract infections?
Some of these circumstances have been mentioned
Mentioned. Okay.
before. We've talked about poor hygiene. We've talked about low socioeconomic
Islamic
status.
status.
We are not eating well. We are just managing, and then we are exposing ourselves
To
unnecessarily. So that one is there. We've talked about even
certain
some
medical
medical
conditions.
conditions too, very important, including background kidney problems, such as people that have kidney
Yeah.
stone is always important. People that have a congenital anomaly of the urinary
Urinary
system
system.
is also very important for them to do so
Also talked about the physiologic changes in pregnancy that predisposes to UTIs
in
in
pregnancy.
pregnancy. Yes.
Yeah.
Then can recurrent urinary tract infection cause cancer or kidney function problems?
Yes, recurrent urinary tract infection can cause kidney function problem
Problem
if poorly managed, and that is
or
why
untreated.
we are emphasizing on the need for us to present early, so that this can be managed before we'll be talking about whether the kidney function is affected or not. Is very, very important. But most of the bacterial organisms that cause urinary tract infection, they are not responsible for cancer development.
Development.
So that's one good thing about it. However,
Some medical conditions.
sometimes people who have cancer of the urinary tract system, they can also present with urinary tract infection.
Infection.
We will not say that is the
Yeah,
UTI
that
that
cause the
cause
cancer.
this one. So it is important, and that's the essence of appropriate investigation, especially for people that are having recurrent urinary tract infection. We need to investigate further.
Further.
There is bleeding every now and then, very important. We are having recurrent flank pain and the likes that could be suggestive of kidney stone, urolithiasis. It's very important that the urologist see and evaluate as appropriate, and be able to tell us that, oh, everything is fine concerning the woman's urinary tract system. Someone is trying to ask, is it harmful to take too many antibiotics?
Yes,
Very
yes,
harmful.
it is.
Very, very
It
harmful.
is. It is.
Even in the hospital, we don't give too many antibiotics. We want to tailor it down to what
It's
is necessary.
sensitive.
You understand? That's why we are emphasizing on the need to go to the hospital. Yes, it's good to go to the laboratory. It is good to go to the laboratory to do urine culture tests,
Culture.
because some of our women are doing that. They will want to go to nearby laboratory, do the urine culture test, and after that one, they will be looking for who to interpret. What do I take? How do I do this? Yes, we are not saying that you should not do, but please, the truth is that it is cheaper to go to the right hospital, to go to the right facility, for you to meet with the healthcare provider. Let us determine the need to do this test. Let us determine how to interpret this test and how to prescribe medication. Because when we are taking too many antibiotics too, we can have drug interaction.
Resistance.
Resistance can develop because most people will not even complete. I started this one, you drop am.
Jump on to
halfway,
another
you
one.
jump at another one. The microorganism will understudy it, and next time you are using it, it won't be effective again. Resistance develop. So that's just it.
Yes, too many antibiotics is not encouraged at all. So another question is, how does infection occur? Is there any hygienic measure to prevent infection? Yes, we've said this over and over again. Hygiene is the number one thing. Improve personal hygiene, yes, will reduce the risk of UTI in pregnancy.
There is an adage that says that cleanliness
Cleanliness
is
is next
next
to
to
godliness.
godliness.
Yes,
Very important.
yes.
Uh,
The
we have talked about before. Part of the things that we are emphasizing on is, hand hygiene, which most people don't take care of,
adhere to.
adhere to prevent so many infections. Now we are streamlining it to urinary tract infection. Hygiene of our private parts. Clean. You don't need to put soap. I want to wash because just water. Clean water is more than enough, and we dry the place. That's it. Also, when we are doing the major, when we want to release the waste product from our intestine, you understand,
Yes,
the way we clean up, we should not clean from
yes.
front from
Back
back
to
to the
front,
front.
yes.
We should clean from front
From to
to
the
the back,
back,
so that we don't carry feces to
from
around our
to the
vagina
urethral
and the
opening.
urethra, that can eventually lead to urinary tract infection. Is very, very important. Well, let me tell us that it's not as if when we see our oga in pregnancy, it will always lead to urinary
UTI,
tract
no.
infection. Of course, what is expected is that we see only our oga, no multiple
Sexual partners.
partners, because that increases the risk of infection.
And
And we have
also
talked
form
about
the
it
habit
too.
of voiding before and
Yes, that's
after.
urinating before and after. Of
Before
course,
and
if you
after.
don't urinate before you go inside, there will be discomfort. Once the bladder is full, you
Before.
won't be able to enjoy it, and it's for pleasure. So we should do that. So also after,
After.
when we void, it will clear our urethra
Yeah.
and reduce the risk of ascend.
Ascending infection.
Yes, very important. Someone is asking, if I have discomfort in the vagina or urinary area, do I have urinary tract infection? It might suggest that you have urinary tract infection. Yes.
Yes.
But before we can say conclusively that you have urinary tract infection, you need to be examined.
Examine
You need to be
history.
investigated. You understand? Very, very important. Please, let's come to the hospital. You'll be checked, and then whatever findings that we make, will definitely discuss with us, and the way forward will be provided.
What is the incidence of urinary tract infection following cesarean delivery?
Wow, the incidence of cesarean section following
UTI
UTI following
following
cesarean
cesarean
section
section.
is actually low in our
Low.
environment. Yes, we know that cesarean section can increase the risk of urinary tract infection. Take for example, when the catheter is being
And,
passed, was the principle of aseptic technique followed?
follow.
We use sterile surgical pack. We open the catheter in a sterile way. We will swab the
Vulva.
perineal area, of course, the vulva, and then over the urethra too, with clostridium solution, Savlon or Purite, depending on what we have. These are antiseptic solution that we use to swab it. We don't use spirit because it's very peppery. So
Ash.
yeah, so we don't use it on a
Vulva.
woman's private part, please. Uh-huh. So that will help in reducing the risk. But the incidence is very low,
Yeah.
just slightly increase above the incidence of a urinary tract infection following vaginal delivery too. Maybe about 4%, 4 to 5%, if at all there is a slight increment. But based on my practice, we rarely have women developing
UTI
UTI,
following cesarean
urinary tract
section.
infection
The
following
cesarean
cesarean
section itself is also an aseptic procedure.
procedure. Yes,
So the risk
is
is very
very
low.
important. And why also is not so common is that we also give prophylactic antibiotics
Antibiotics.
following the surgery,
Yes.
so it helps. And most of the antibiotics that we give
Broad
during this, they
spectrum.
are broad spectrum that can take care of most of the germs, the microorganisms that can be responsible for urinary tract infection in pregnancy.
Okay. Um, Someone asks, why are urinary tract infections more common in women than in men? Yes, yes. UTI is commoner in women than in men. One which we have mentioned earlier, the short urethra in females.
In fact, the
Second
urethra,
is
the
about
urethra in male
is about
is
four
about
five times longer than in
longer
females.
than in female. It's just about 4 centimeter
4 cm.
long, like that. And also because it's closer to the
Vulva,
vagina, it's closer to the
anus.
anus too. So that one also underscores
Contamination
why.
from those areas can ascend
Yes,
to the urinary tract,
very, very
predisposing to
important.
UTI. And other factors like other risk factors like sexual activities also predisposes women more because of the anatomical
Environment.
environment. Yes.
Yes.
Any other
Well,
question?
if you are just joining us,
Okay.
uh, I am Dr. Taiwo William, consultant gynecologist and obstetrician at Limi Hospital, Central Business District, Abuja. And with me is
Dr. Amanda Chinyere Dikeukwu, personal physician with Limi Hospital, Central Business Area, Abuja.
yes, we've been discussing urinary tract infection in pregnancy, which simply means the presence of actively dividing microorganisms in the urinary system, which includes the bladder, the kidneys.
Kidneys,
Of course, ureter is also part of the system, but
tract.
the urinary tract, but majorly the bladder and the kidneys are involved, and they can produce symptoms. So we've been entertaining some questions, and the questions, oh, God bless all the people that have raised all these questions. They are quite important questions that every one of us at home, all our viewers, need to know, need to understand, and we need to know uh, how to approach this particular topic so that we can avoid or prevent the complications that can result from
Poorly
urinary tract
treated.
yes, from poorly treated urinary tract infections such as miscarriage, preterm contraction, preterm labor, preterm delivery, and problems of prematurity,
Prematurity.
even intrauterine growth restriction, meaning that the baby is not growing as expected. Also,
Or
there is risk.
perinatal deaths, even.
Yes, that's
Hallmark.
the extreme of all these things that we have been discussing. In the mother too, because of the urinary tract infections, their blood level can start going down, meaning that they can have anemia. People can be feeling extremely tired.
And it's in
Not
very severe cases, shock can lead to
yes.
so many other systemic complications.
So we want to appeal to all our viewers out there. When we register for antenatal, let's always endeavor to have urine tests done at every antenatal visit. It's important. It's not a waste of time. It's not a waste of resources. It's helping us to identify risk that can negatively affect or impact
Outcome
the
of the
outcome of
pregnancy.
our pregnancy, especially with regards to
The
the outcome
mother,
of our children and then the
mother.
woman that is also pregnant. We want to stop here. We want to appreciate every one of us for joining us. I don't know, maybe
I
we
do
just
hope
started about 10 minutes ago. It's up to an hour. I think it's up to an hour. We've been
it's
discussing
up to
this.
an hour, about 45 minutes, not up to an hour. Yeah.
Yes.
Thank you
So
for joining us. We hope you
you
appreciated the lecture and the answers to your questions for those of us that asked questions.
and we would like you to join us next week. Other topics will be discussed. Interesting topic. You trust us in this facility. We discuss topics of interest as it affects our health, the health of women, the health of men, the health of children, the health of the nation at large. We want our nation to be healthy. That's why we come up every Friday to discuss different topics as it affects our
Health.
health. It's very important. I also want to use this medium to invite all our viewers out there to join us for Abuja Health Walk every last Saturday at Limi Hospital, Central Business District. We do exercise, regular exercise work out to ensure that we live healthy, we can have a better cardiovascular system, we can live long. And there are other benefits that comes with that Abuja Health Walk that we do at every last Saturday. There are other programs, including for the past few months, we've been trying to do free cardiopulmonary resuscitation training, how to ensure that people knows how to resuscitate those that collapse. Like for example,
The basic life
cardiac arrest, which is now more rampant in our environment.
yes.
People will just see
Fall
somebody
down and
small
collapse.
and they bring out their phone, snapping and say, "Hey, somebody just
No, that
You
time of
want
snapping can be used to resuscitate the patient to an extent
yes,
before help comes.
yes. We also do free hepatitis B screening and vaccination. You don't need to pay for it. You can go to places, they can tell you how much they screen for hepatitis B, and then you have to pay for vaccination. We give it freely to improve the health of our community. You can join us, and I want to assure you, you will never regret it. I'm sure if only you have joined us just once, you will want to invite other
10
people,
more
family
people.
members, friends to join us. It's a wonderful experience, and we want to see you there tomorrow.
Thank you so much, our viewers. We appreciate your I will appreciate you joining us and listening to our lectures. See you next weekend and
Thank
tomorrow
you.
for the health walk. Health is wealth. Let's take our health seriously. Bye bye.
Bye. Thank you.